In part one of our investigation into the global impact of COVID on the lives of people with disabilities, we investigated the disproportionate numbers of deaths amongst disabled people. A fact starkly illustrated in the UK, where by September 2020, 3/5 of COVID-related deaths had been persons with disabilities.
The government knew from the very, very beginning that disabled people would be vulnerable to coronavirus. They knew that.
In this part, we investigate allegations that do not resuscitate orders were applied to disabled people without their consent or the approval of their carers.
It's somehow saying that other people's right to life is more important than ours.
And as vaccines against COVID begin to be rolled out across the world, the fight to ensure disabled people are not left at the bottom of the queue.
I understand that people living with disabilities can have fear that they will not receive a vaccine, but they should. It needs to be a universal public good.
Our investigation took us across Europe.
Just as we've arrived here, governments are introducing travel restrictions to protect their citizens. So, whilst we journey around Europe, we have to observe strict COVID protocols.
But as we travelled, and more countries went into lockdown in a desperate bid to contain the pandemic, we began to hear concerns from disabled people and their supporters, fearful that behind locked doors, the rights of disabled people were being ignored or denied. In the Greek capital, Athens, I met one volunteer from a home for disabled children who told me a disturbing story. She'd been on leave at the start of the pandemic, but when she came back to work, she was shocked by what she found. Fearful of reprisals, she asked us to preserve her anonymity.
So the direction they chose is to go back to methods that we think are not used in our times anymore, like tying them up, increasing the medication. They were hitting them on the neck and shoulder with a wooden stick, even hitting the children on the head with this wooden stick, because they see that it is a method that is working. With working, I mean that the children get so afraid that they are not reacting anymore.
She began taking photographs. A child whose hands and neck were tied. A youngster who, she says, was strapped half naked in a wheelchair.
Then what is happening is that there are scars because the child is tied in such a strong way with a belt.
And this girl with Down syndrome, who was left in this cot.
She spent many hours in this bed. She started to have behavior like eating her own diapers. She was 14 years old when she died. How she died is quite uncertain because we believe that they are trying to keep it as a secret. She had a heart problem. You ask yourself what is better for that child, of dying and finally leaving this inhumane world of violence and discrimination and sadness.
It seems that worker's experience was not unique. Dr. George Nicolaides is a leading European disability advocate, and he was hearing stories from around the country.
We had reports for restraining practices returning back, especially with institutions for adults or children with disabilities. We had reports for extreme punishing practices for children in institutions for children, and these were kind of normalized, in quotation, because they were regarded as natural given the urgent situation, both by the management of the institutions and by the personnel.
The Greek government has not responded to our request for a comment. We arrived in France in October 2020, just as President Emmanuel Macron announced an extension of COVID restrictions. The announcement was particularly worrying for care worker Mélodie Bouget, who I met in Paris, because she'd already seen the effects of the first lockdown.
Ce qui m'a surtout alarmée, en fait, c'était de voir en fait les conditions dans lesquelles les personnes étaient, qui n'ont pas pu avoir accès aux soins. Il est arrivé une fois qu'on n'ait pas de matériel pour nourrir quelqu'un. C'était très très difficile.
Melody said she'd seen residents with learning disabilities physically restrained and locked in rooms. She feared the new lockdown could only make matters worse.
Pour moi, c'est une obligation citoyenne, c'est une responsabilité citoyenne de signaler, de parler, en l'occurrence aux autorités, quand quelque chose semble injuste. Là, en l'occurrence, on parle de restrictions, de restrictions de liberté, on parle de droits humains fondamentaux. La liberté est un droit humain fondamental. Et ce qu'on remarque, en fait, c'est qu'il y a des droits humains fondamentaux qui ont été bafoués. Et donc, dans ce cas-là, il me semble normal, même si ça peut être risqué, de prendre la parole sur ce sujet-là.
While we were in France, we were shown a video which had been circulating on social media, which seemed to show a young man left unsupervised outside a care home on the outskirts of Lyon, a video which caused deep concern to disabled activists. It was filmed by a taxi driver who'd been alarmed to see the apparently unsupervised young man stuffing tree bark into his mouth.
Non, faut pas mettre dans la bouche. Hé, monsieur, ça fait mal, faut pas mettre dans la bouche. Est-ce qu'il y a quelqu'un? Frérot, il y a quelqu'un qui s'occupe d'eux ici?
When he can't find staff, he calls the police.
Bonjour madame, en fait, je suis un chauffeur de taxi. Il y a un gamin dehors qui est en train de manger du bois. Et le sang, il coule de sa bouche. Il n'y a personne dehors. On a crié, voilà, il n'y a personne. Et lui, il va mourir. S'il continue comme ça, il va s'étouffer.
Eventually, staff members come out of the home.
Madame, il y a quelqu'un qui s'occupe de cette personne-là? C'est pas un animal, là, c'est un être humain. Mais là, c'est pas normal qu'un être humain, je considère comme mon fils ou mon petit frère ou quelque chose comme ça.
Attendez, je vous explique. Les jeunes, on les a fait sortir.
Ouais.
On les surveille.
Ouais.
Ce résident, on a l'habitude qu'il mange des choses, donc on fait attention à ce qu'il mange.
Oui, s'il mange des choses, vous donnez un truc à manger, vous donnez pas des morceaux de bois.
The effect of the video was to increase the fear felt by autistic people that they were both out of sight and out of mind as a result of COVID.
As an autistic person, as a member of that community, it's just appalling to me. I'm scared that situation is going to happen all over again with autistic people.
The foundation which runs the Lyon home strongly denies any suggestion the video was indicative of systematic failures. They sent us what they said was a more representative video of their homes and insisted the taxi driver's footage
in no way reflects the quality of the support we provide within this establishment.
And that
this non-verbal adult person is in good health and has not suffered any mistreatment.
In the UK, people were voicing similar concerns, and in May 2020, a parliamentary committee began investigating the effects of lockdown on vulnerable disabled youngsters in mental health hospitals. One mother, Adele Green, who was invited to give evidence to that committee, described the devastating effect of the lockdown on her son. Because of COVID, the committee met remotely.
Good afternoon, Adele. Can I ask you, could you tell us something about Eddie's current situation?
So my son, Eddie, is currently detained under a Section 3 of the Mental Health Act. He has a learning disability. He's been in units for 7 years, so since he was 13. He was actually about to start the discharge process back to his local community. Unfortunately, when the lockdown came, the hospital placed quite a blanket ban on anybody going in and anybody going out. Because there are live cases of COVID on his ward, he couldn't leave his room. And within a week of the fear for him and the anxiety, he tried to take his own life, which is something that really blew us away, really. We just couldn't, we were mortified.
When the Parliamentary Committee published its findings in June 2020, they said the lockdown in mental health hospitals was
making the risk of human rights abuses even greater.
It warned that bans on visits, suspension of inspections, and increased use of restraint and solitary confinement had
created a severe crisis.
But while many across the world worried about the effect of the lockdowns, in the UK there was another highly disturbing development. It concerned these Do Not Resuscitate Notices, DNRs.
So each of us, we will all at some point die. We should really think about what we would like at the end of our lives. A do not resuscitate or a do not attempt cardiopulmonary resuscitation notice is really about not performing CPR on people.
Properly used, DNRs can serve a very valuable role, allowing people, usually at the end of their life, to choose to die peacefully rather than undergo distressing attempts to revive them. But one important condition is that DNR notices are only put on records with the informed consent of a patient, their family, or a patient's representative. And early in the pandemic, disabled advocates noticed a disturbing trend. DNRs were being applied to disabled people without proper consent.
My team has had a steady trickle that come across our desks as part of our routine monitoring of services. What we saw in April was basically a year's worth in a month. They're procedurally incorrect, the family haven't been involved, and that they say learning disability or Down syndrome. That isn't a reason to not give CPR when it's needed.
Sounds a shocking state of affairs.
Yes, in a word, it is shocking. We have managed to have the doctors withdraw a fair number of these DNA CPR forms.
When another charity, Learning Disability England, asked their member organisations about DNR notices, half of those who responded reported that as the pandemic grew in March and April, they'd found DNRs placed on medical records, apparently without consultation. For activists like Simone Aspis, who has a learning disability, the revelation was deeply troubling.
If doctors are putting do not resuscitate notices into a whole number of people with learning difficulties, medical notes, right? Then what is it? You know, what is it if it's not eugenics? You know, it's clearly they have learning difficulties, right? No, they should not get access to healthcare treatment. We'll let them die.
A survey conducted by Professor Leary and her colleagues suggested nurses in long-term care facilities were also worried that DNR notices were being applied to disabled people's files without their permission or proper consultation.
One of the really considerable ethical issues was around the use of blanket do not resuscitate decisions. To issue a generic notice for a group of people without individual person-centred care being the focus of that decision was something that the respondents to the survey really struggled with.
In autumn 2020, the Care Quality Commission, a body that regulates care in England, was told to carry out an urgent investigation into DNR notices. So we asked them how many disabled people may have died as a result of wrongly applied DNR notices.
Well, I think it's like any other professional poor practice. It's ultimately an unknowable question.
I mean, this is a very serious situation when blanket DNR policies are being adhered, isn't it?
Blanket DNA CPRs are completely unacceptable, and we've been very clear on that.
The CQC's full report is due in February 2021. But in December 2020, the body released an interim finding which acknowledged that do not resuscitate orders were wrongly allocated to some care home residents during the COVID-19 pandemic, and that this caused
potentially avoidable deaths.
It warned that inappropriate do not attempt cardiopulmonary resuscitation notices applied in the spring
may still be in place.
December 2020, and the UK became one of the first countries to roll out a COVID vaccination programme.
Today, we can announce that the government has accepted the recommendation to approve the Pfizer-BioNTech vaccine for distribution across the United Kingdom.
For disabled people, their families and supporters, it was a glimmer of hope. At this Hertfordshire home, where dedicated staff spent months devoting their energies to caring and protecting residents with complex needs and epilepsy, it was the breakthrough they, residents and families, had been waiting for. 39-year-old Katie Lay has a severe form of epilepsy, experiencing frequent seizures.
It really scares you because the form of epilepsy that she has, when she's ill, her seizures get worse. So I would class her as very vulnerable, and I would want her to be in one of the top groups to be vaccinated first, to just give her more chance of getting on with her life.
So had a lessons been learned? Despite evidence showing that 3/5 of COVID-related deaths in the UK had been of persons with disabilities, when initial guidance on who would be prioritised for the UK vaccine was published, disabled people were not even mentioned. The first category, into which many of those under 65 might fit, was number 6 out of 11. Steve Scowen's organisation provides care for disabled people in the community.
I thought it was predictable and my heart sank. I thought yet again the government's priority has been on registered care homes and people who are equally or in some cases more clinically vulnerable are not on those priority groups.
Yet again, disabled campaigners found themselves fighting a rearguard action to insist people with disabilities were not forgotten. The issue was raised urgently in the UK's House of Lords with a remote contribution from a disabled peer.
Baroness Campbell.
I am concerned to learn that those under 65 in the clinically high-risk category have been given a lower priority for the vaccine. Disabled people tell me that they have not felt shielded or protected throughout this pandemic, and this priority decision seems to confirm that belief.
After another campaign, the UK government did amend its vaccine priority list. Whilst this was great news for homes like St Elizabeth's, it did create another inequality. It seemed only those in care homes would be prioritised for vaccinations, not those who may be equally as clinically vulnerable but living in the community.
You can have a pair of twins, if you like, one living in a registered care home, one living in a group living service, same diagnosis, same clinical need, but the person in the registered care home will be treated very differently right at the top of the priority list, and the person who has similar needs because they live in a different type of service is much further back down the queue.
Disability advocate Anne McCullum has cerebral palsy and lives in a flat with carer support. When we spoke to her in January 2021, she told us she hadn't had any information about whether she'd get the vaccine.
I still don't know. Am I waiting for that? How am I going to get that information? In my opinion, they've forgotten the people that have care in their homes. It would mean so much to, I think, everybody to have that vaccine, to eventually meet people again. It would mean freedom.
Across the globe, there are now growing demands that disabled people's voices are heard when vaccine programs are rolled out.
No one is going to be safe unless we're all safe. When there is a vaccine, it needs to be a universal public good. Everybody has to have access. And of course, people living with disabilities, of course, they need to have access.
But internationally, there are few signs that the disabled are getting adequate access. The European Union's vaccination strategy, adopted in October 2020, made no mention of persons with disabilities. And one international NGO told us that in many countries, people with disabilities risked not getting access to vaccinations at all.
Almost 80% of persons with disabilities live in poverty, live in poor countries. This means that if the vaccination is not going to be distributed in an equitable way and doesn't reach the poor group, persons with disabilities are also going to be excluded. So our major fear is that the vaccination does not reach persons with disabilities on time, and we keep losing lives and livelihood. Persons with disabilities and their representative organizations are not being consulted. If we really want to change this and break this vicious cycle of exclusion and discrimination, we should invite persons with disabilities in the decision-making process.
But far from having their voices heard, the evidence suggests many disabled people are being left increasingly isolated.
The strict quarantine measures that were put in place increased the risk for children with severe disabilities who had pre-existing conditions. They were also exposed to higher risks of abuse and neglect and exploitation during the lockdown.
And according to NGOs who organised a global international survey into the effects of the pandemic on disabled people, lockdowns have left many across the world in institutions without minimal protections.
When you don't have eyes watching, the most terrible abuses will take place, guaranteed, behind those closed doors. And ombudsmen have not been able to operate, independent human rights monitors have not been able to visit, so suddenly the curtain has come down on institutions.
There were many types of abuse that were alleged by the respondents to this survey worldwide. One of them was about very strict enforcement of lockdowns by police, sometimes military and other security forces, in some cases resulting in extremely serious incidents and even the death of people with disabilities who either could not hear or were unable to understand instructions or were unable to show that they were cooperating with these very strict rules. But there were many other types of abuse and violence as well. There was an uptick in violence against women and girls with disabilities who found that they had nowhere they could go, essentially being locked down, sometimes in abusive situations.
The COVID pandemic has traumatised the world, a truly seismic event which has left few untouched. But while much of the developed world cautiously celebrates the beginning of hope that the virus may be vanquished, for many disabled people, the future looks far bleaker. 2 years ago, in October 2019, when People and Power filmed with disabled protesters on the streets of Brussels, the mood was of optimism and hope. But today, campaigner and lecturer Nadia Hadid warns that COVID has changed all that.
I have been stopped by people on the street telling me, do you think it's really very prudent to come out at the street in your condition? And I was looking at that woman, I told her, what is my condition? She told me, you are weak and you are more vulnerable. I told her, who gives you the right to judge me, first of all? And I told her, maybe my health is maybe better than yours. I just have a broken neck and I'm paralyzed. But for the rest, I'm just like all of you. I have my reasons to get out. And even without reason, it's my damned liberty.
Nadia's experience was not uncommon. Across the world, disabled people and their supporters are warning that many of their hard-won rights, effectively suspended under cover of the pandemic, could be gone forever.
We've lost many of the successes of recent decades.
We are going backwards instead of going forward. We are going towards the 19th century.
This whole COVID pandemic brought with it the image of people with disability within the society has been damaged a lot, because we are all seen like vulnerables, like those who need help, those who are costly into society, instead of people having rights.